Greetings. Let us talk about endoscopy accessories. During the procedure, the endoscopy technician uses a lot of accessories to help with the procedure. And let us look at what all a technician will be using for general GI endoscopy cases. Here is a big list, and let us take each one and talk about its use. First is a cap or distal attachment cap for the endoscope. This is how it looks. You attach the cap to the end of the scope, and it helps the endoscopist to examine difficult areas of the gastrointestinal tract. Say, for example, high up in the cardia and the duodenal bulb, angle, etc. The cap allows to stabilize the area of interest so that the endoscopist could perform detailed examination, figuring out the nature of the lesion. It is also helpful as an aid for various therapeutic procedures. Say, for example, there is bleeding during the procedure, the endoscopist uses the cap to apply tamponade or pressure on the bleeding area to stop it, while the technician gets him additional equipment to treat that area. So next, let us look at spray catheter. This is how the spray catheter looks, and it has many uses. It is basically used to spray dye, and the dye spray is used for screening esophagus for squamous cell cancer using Lugol's iodine, acetic acid for screening Barrett's esophagus and dysplasia or cancer in Barrett's esophagus. In the stomach, acetic acid is used to evaluate the extent of gastric intestinal metaplasia. In the duodenum, we spray either indigo carmine or methylene blue to check polyps in patients with familial adenomatous polyposis or FAP or MUTH adenomatous polyposis or MAP. In the colon, indigo carmine or methylene blue are used for again checking for polyps, FAP patients, MAP patients, and HNPCC or Lynch syndrome patients. The same dye, indigo carmine or methylene blue, is also used to screen patients with IBD, especially those with ulcerative colitis or Crohn's disease that's been going on for 10 years, checking for cancer or precancerous lesions. And finally, acetic acid is also used if you see a serrated polyp and you want to define its extent, its true extent, because serrated polyps are very difficult to figure out how big are they. Next, let's talk about cytology brush. There are two types of brushes. One brush that goes through the reguloscope during EGD, and the second one with a guide wire for brushing the bile duct during ERCP. So the cytology brush is used for checking esophageal candida. If you see white stuff in the esophagus, you take a brush and check it out. And it is also used in addition to biopsy to check for infection and cancer. So, if there is a bile duct narrowing or stricture, you take biopsies, you use a brush to check for cancer. Next, let us look at biopsy forceps. This is how the biopsy forceps looks like, and it is used whenever you see something suspicious to make a diagnosis. Is it cancer? Is it inflammation? Or is it infection? It is also used when you have the area looks normal, but when you see the patient and you worry about certain conditions. A young person with difficulty swallowing, and you think about eosinophilic esophagitis, the esophagus looks normal, you take biopsies to check for that. If somebody has abdominal pain and you worry about Helicobacter pylori infection, the stomach looks normal and you take biopsies to check for that. If you have somebody with either loose stools or iron deficiency anemia and you think about celiac disease, you take biopsies from the duodenum even if the duodenum looks normal. And finally, an elderly patient with the loose stools, the colon looks normal, you take biopsies to check for microscopic colitis. And biopsy forceps, especially a jumbo biopsy forceps, that is a big forceps, can be used to remove small polyps less than 3 millimeters in size. So, these are the different types of biopsy forceps: standard cup, jumbo cup, with or without the spike, and there is a hot biopsy forceps that allows current to make it hot, and hot biopsy is used to remove tethered polyps. When you have a spike, it allows you to take multiple biopsies, so that the spike hangs on to the first biopsy and you can take a second biopsy. Next, let us look at injection needle. This is how an injection needle looks like, and you use different substances to inject. And let us look at some examples. You can inject epinephrine to control bleeding from vessels. A good example is a patient with ulcer bleeding. Other conditions where there is bleeding from the vessels or arteries is Mallory Weiss tear, that is somebody who retched and tore their esophagus. Delafoy lesion, colonic diverticular bleeding, or bleeding after removal of polyp. You could use a sclerosant like sodium tetradecyl sulfate or glue to treat bleeding from veins, or esophageal varicose veins, or gastric or fundal varicose veins. You use saline with or without epinephrine mixed with either methylene blue or indigo carmine to inject fluid and lift a polyp away from the muscle, that is submucosal injection, to aid in the resection. You could inject a tattoo to make a mark for subsequent examination, or to help the surgeon find out where the tumor is when the patient goes for surgery. Could also inject botulinum toxin that relieves the spasm of the muscle, and this helps in patients with achalasia. So, there are lots of different uses with the injection needle depending upon the substance that you inject for a particular condition. Next, let us look at band ligator and Blackmore tube. This is what a band ligator looks like, and it is used for treating variceal bleeding. That's the main reason it is used, especially esophageal variceal bleeding. And sometimes you can use it for gastric variceal bleeding, those that are just going in the cardia along the lesser curve. Banding is also used for controlling hemorrhoidal bleeding. In addition, banding is used to control bleeding from vessels like Mallory-Weiss stare, doulofoilation, colonic diverticular bleeding, and bleeding after polypectomy. Banding is also useful to control bleeding from capillaries like a watermelon stomach or arteriovenous malformation in the stomach. And banding is also used to lift the polyp tissue into the band and do band ligation followed by endoscopic mucosal resection. This is used in the management of patients with Barrett's esophagus with either dysplasia or early cancer. It is also used in the rectum for removing carcinoid tumors. So, these are all the different uses of band ligator. Next, let us look at Sengstaken Blackmore tube, and this is used when you cannot control bleeding and you want to stabilize the patient. You put the tube down the esophagus into the stomach, and there are two balloons. You inflate the gastric balloon and then the esophageal balloon, and it is used for controlling esophageal variceal bleeding and gastric variceal bleeding. Next, let us look at multipolar probe, and this is a Cautery probe. This is used with the help of an electrosurgical generator. It is used to cauterize blood vessels. Typically, after you have controlled bleeding from a peptic ulcer with epinephrine injection, you cauterize the vessel, and that's how you control peptic ulcer bleeding. It is also used for cauterizing bleeding from Mallory-Weiss stare, doulofoilation, colonic diverticular bleeding, and also sometimes for post-polypectomy bleeding. It is also used for controlling bleeding from small capillaries. Examples include watermelon stomach, arteriovenous malformation, and radiation telangiectasia in the rectum. Next, let us look at another device, heater probe, and what it does is it heats up the tip, and it is used for controlling bleeding, peptic ulcer bleeding, doulofoilation, post-polypectomy bleeding. It can be used for again control of capillary bleeding, watermelon stomach, arteriovenous malformations, and radiation telangiectasia. Next, let us look at hemostatic forceps. This is how a hemostatic forceps looks like, and let's see what are the uses. Recently, it's been shown to be useful in controlling bleeding from peptic ulcer and bleeding after removing polyps and after EMR and ESD, and also to prevent bleeding during EMR and ESD. And they come in different sizes. Next, argon plasma coagulation. What are the uses of argon plasma coagulation? It is used again with an electrosurgical generator with the help of argon gas. Typical uses are for vascular ectasia, bleeding ulcers, and sometimes has been used for obliterating varices once you've treated them with other modalities first. It's also used to ablate tissue like Barrett's esophagus, residual polyp after resection, sometimes debulking cancerous tumors, and also ablating ectopic gastric mucosa at the upper end of the esophagus. And this has been used to recanalize occluded metal stents or cut migrated stent, and it's been used for treating Zenker's diverticulum also. So, these are the different types of argon plasma coagulators depending upon how the beam goes. It could be aerial beam type, side fire type, or circumferential beam type. Next, let us look at hemostatic spray or hemospray. So this is the device, and it is used for controlling bleeding, especially if your regular stuff doesn't work and you want to control bleeding, and you spray. And this has been shown to be useful to controlling bleeding temporarily in a variety of conditions. Next, through the scope clips. This is how a through the scope clip looks like. There are different varieties, and let us see the different uses of hemostatic clips. One, controlling of bleeding, again peptic ulcer bleeding, Mallory-Weiss tear, Dolofoy lesion, colonic diverticular bleeding, post-polypectomy bleeding. It's also used for closure, closing mucosal defects after endoscopic mucosal resection or endoscopic submucosal dissection, and is also used for closing perforations if they were to happen during endoscopy. It's also been used to anchor, that is anchoring a feeding tube to the jejunum, anchoring a stent to the esophagus, and anchoring manometry catheters in different sections of the gastrointestinal tract. It's also used for marking and to place stents for radiotherapy. So you can mark the site of the cancer with a clip, and the radiotherapy therapist uses the clip to focus the beam. And if the patient is bleeding from an ulcer and you can't control the bleeding, you can apply a clip close to the ulcer, and that clip will help the interventional radiologist where to place the coils and glue during interventional radiology procedure. Clips are also useful for the surgeon to find out where the tumor is. And finally, in very difficult ERCP, when the bile duct is covered by a hood of fold, you can move the fold up and clip it up and facilitate bile duct cannulation. Next, over the scope clip. Over the scope clip is used again for controlling bleeding, closing perforations, and closing fistulas like a gastrostomy fistula, and anchoring stents. Next, suturing device. This is how a suturing device looks like, and suturing devices have been used quite a bit for anchoring stents. That is an esophageal stent that you don't want it to migrate down, and it's been used a lot to reduce the size of the stomach. It's called gastric reduction. Either somebody who has not had surgery or somebody who has had a bariatric surgery and the stomach has become bigger after the surgery, and you want to reduce the gastric pouch. It's also used for closing perforations and closing fistula like a gastrostomy fistula that has not closed. Next, cold snare. This is how a snare looks like, cold snare, where you do not apply any current, and cold snare is typically used to remove polyps between 4 to 10 millimeters in the colon. Next, hot snare. Hot snare uses electrosurgery in addition to mechanical cut, and it's used for removing polyps about 10 millimeters. You can use it also for 5 millimeter plus polyps for endoscopic mucosal resection, and its snare is also used to remove foreign bodies like a bile duct stent or a pancreatic stent that you want to take it out. You can use a snare to pull it out. Next, ligating loop. If you see, this is how a ligating loop looks like, and if you see a large polyp with a thick pedicle, those polyps tend to bleed a lot, and you can put a loop and cut off the blood supply either before or after cutting, and cut down the risk of bleeding. And some experts have used a loop to close defects and to close perforations as well. Retrieval net. So once you remove a polyp and the polyp is big or multiple pieces, you use the retrieval net to pull the polyp specimens. It's also used to remove foreign bodies like a food bolus obstruction of the esophagus. Next, retrieval trap. When you are removing small polyps, the endoscopist suctions the polyp and the polyp comes through the suction channel, and you attach the retrieval trap to retrieve the polyp. Retrieval hood. This is how a hood looks like, and you attach it to the end of the scope and evert the hood, and once you go into the stomach to retrieve sharp objects like safety pins, nails or blades, and then when you pull back, the hood that is everted becomes to regular shape, so that as you remove the scope from the stomach, the hood actually protects the safety pin, nail and blades from causing any damage to the esophagus or the mouth. Overtube. Overtubes are typically used for retrieving foreign bodies, and another instrument, that is rat tooth forceps, again used for removing foreign bodies. They are also used for removing stents. There are different varieties depending upon the size and shape. Nasogastric feeding tube. This is the tube that is used most often on the hospital floor for short-term feeding. Nasojejunal feeding tube. This is the tube that is usually put in by the endoscopist. He goes into the small bowel, he puts in a wire, and over the wire he slides it again for short-term feeding. If the patient's stomach is not working well, you want to feed the jejunum. Peg tube or gastrostomy tube. This is used for longer term enteral feeding. It is also used to vent the stomach if somebody is vomiting again and again because of obstruction of the outlet of the stomach or the small intestine. You place this tube so that the patient can use this tube to vent the contents out. Balloon dilator. So these are the different types of instruments required: catheter, syringe, and the mechanism to inflate the balloon. And balloon dilator is used to dilate esophageal strictures, pyloric strictures, colonic strictures, anastomotic strictures, as well as dilating biliary and pancreatic strictures. Bougie dilator. This is typically used for dilating esophageal strictures. Stent. Stents come in different sizes and shapes, and they are typically used to relieve malignant obstruction. They are also used to bridge leaks and treat perforations or anastomotic leaks. They are also used for draining fluid collections. They have been used to create anastomosis between the stomach and the jejunum, like the surgeon does, gastrojejunostomy. And sometimes if you have somebody with an altered anatomy, somebody who has had a bariatric surgery and you cannot reach the bile duct, you can enter the stomach from outside, place a stent, and from there go in with your ERCP scope to do the ERCP. So there are a lot of accessories that the technicians use. It's a good idea to learn about their uses. Complications of any instrument, if you don't use it right, you can cause trauma. It could lead to bleeding, and if you cause more trauma, it could lead to perforation. Thank you.